65% of people will get 85% of their care via AI. And that's a significant reduction in primary care and in the traditional model.
What I'm saying is that the smart money is going towards the AI, but then clinical intervention versus economic drivers are different.
There's so much money that is, let's call it wasted, or it's not optimized.
Good morning, everyone. Again, thank you for joining Signals and Symptoms podcast. Today we have two special guests. My two co-hosts, besties, are going to act as guests today. The question is that we keep talking about patients, we keep talking about AI and healthcare AI, and then it's going to change the trajectory of care coordination. But the minute the care coordination changes, the economics changes behind it. Like how hospitals going to rewire in the age of AI, how clinics are going to go rewire. So basically what I'm trying to say, there's a twin disruption. One is, of course, the medical part of it. The other one is essentially how the cost reduction impacts, how the revenue growth changes, how the optimization completely changes as well. Now, a reminder that healthcare is also a business, and therefore business comes with, a lot of things, right? That how is it going to really change, and how do we see the future in 1 year, 2 years, 5 years, and 10 years as we go along. So just to prime the discussion up, I'm going to give you two major, in my opinion, some observations. Number one, my sister is a psychiatrist. She teaches a lot of psychiatry residents, and then she now moved away. But what she had noticed is that essentially nearly 90% of her psychiatrist classes are moving towards, for a lack of a better word, concierge medicine, telemedicine, more importantly, essentially cash pay. And observation number two is the rise of the wellness part. We talk about healthcare, but essentially med spas, chiropractors, etc., all of them are now using labs, using imaging, and also now adding personalized treatments, including peptides, and then of course essentially moving forward. So all of that basically is now impacting. So problem number one, AI is disrupting care. Now we have started it, how it is disrupting the complete financial chain of the solution part. So I'm going to start with Ed. So first you can set the stage better than I do. And then let's start with a mega concept of US hospital systems. Then we'll come to Harvey, which is basically global what's happening. And then we'll, peel into each layer of this smelly onion one at a time, because people don't even like to admit that healthcare is a business, which is odd. Anyways, go ahead.
Yeah, I think healthcare is about to be disrupted in a massive way. We've talked about that in the past with virtual care, and of course we saw it actually happen with the pandemic. But then we all went back pretty much to the old standard ways because that was the economics. So if you look at what's happening just this year alone, a Wall Street Journal had another article coming out this week where it's talking about how there's been 4 consumer-facing products that have come into reality this year alone, and they are completely going around healthcare systems. No one really pays attention because it's kind of status quo. It hasn't hit their pocket, but yeah. And there was a quote from there, I'm just trying to pull it, that, hey, we have to change our business models or be lost. When a general purpose AI can field health questions at consumer scale with no procurement chain, the implicit message to health IT buyers is uncomfortable. The friction we've built, right, hospitals we've built into our vendor onboarding process is becoming a competitive liability, because we all know it can take, I was talking to a different person yesterday, 18 months. They finally went through all the governance structures and it took 18 months. And he said by the time their technology was approved, it was obsolete. They had already come out with the latest and greatest. And so because we're so slow to adopt new things in healthcare, so a competitive liability, not a quality filter, right? We've created these governance processes. We've created all these filters, all these reviews, it's a liability today. Think about uh, Clay Christensen's, the innovation dilemma. It's a perfect situation where we're going to be disrupted unless we make changes right away. We're going to be disrupted by these outside forces. I interacted with three of the top five, according to U.S. News and World Report, three of the top five health systems in the last 2 weeks. Only one understood what we're talking about and was actually doing something. They recognized that the old way isn't going to work, and they had to take some risks. They had to take some bets with different types of companies and start working with them.
It's very amazing that you told the story about something that is insane, that even the employees themselves, including, yes, I mean, I have nurse practitioners who are not asking enough questions to me that like they used to. I have nurses who would just say, hey, I got this from ChatGPT, do you agree? And then they move on. It's kind of scary as a physician that that the reliance is on a tool that is not vetted. Harvey, give us a contrast of how things are changing globally in this context, and how, when we have an insurance-based system, privatized healthcare, but what happens in a public healthcare systems? How are they coping in this new reality where not just the care is disrupted, but economics are?
Yeah, so what I find fascinating is all of this. To me personally, I feel like this ties to culture. Other countries have always done things differently, obviously, that's why the culture comment. And so I find it interesting how the correlation plays into healthcare. Example, I went to Dubai, very strict. I loved it. It was really interesting, but it's a top down effect. They're like, this is what we want to do. This is how we're going to take care of healthcare. And it's coming from the top, and it's being honored all the way through. They're leveraging the data of AI for the entire population. And that just shifts the way healthcare is delivered. Obviously, what we're talking about, Ed explains, we have pain points here in the United States. If we didn't have any pain points, we wouldn't have international medical travel. It wouldn't exist. That the reason it exists is because there's such a problem here in the state. There's so much money that is, let's call it wasted, or it's not optimized. And as a result, other countries, some of these things can be 10 times cheaper than the United States.
So true. I mean, even the traditional care that we are already experiencing is changing. I mean, we're going to see how the oil prices are going to change. Now, more importantly, we're seeing that investors see it. So if you follow the money, which is essentially, we think investors are smart money, which we don't know. But what I'm saying is that the smart money is going towards the AI. But then the clinical intervention versus economic drivers are different. So, Ed, when you're seeing this and when you're talking to hospitals, that you are looking at the future where, first of all, hospitals are already cash strapped. When you reduce essentially hospital admissions, how are hospitals going to cope with it in the next 2 years, 3 years, 5 years?
I always said that they may sell off some assets and some of the community assets.
So you're going to recommend as a board member that you have to restructure your whole sort of play.
Yeah, think about it. If you're, again, I'm sure there's some hospitals that have a different system, but the majority, the PCP is the lifeline. And if that PCP, one of the predictions I've made, and we'll test it and we'll find out if it was right or not, that 65% of people will get 85% of their care via AI. And that's a significant reduction in primary care and in the traditional model. So who's going to tell those individuals, where they're going to go for their specialty care? What are they going to do? Well, one is, we've talked about this before, is they need to jump in the game. They need to offer bimodal treatment options. Two, they need to double down on the virtual care that worked so well during COVID. And again, why did we leave it? Third, they need to offer, these AI agents. They need to replicate what these other consumer grade products are now doing.
So basically, what you're saying is that hospitals will need to rewire go from brick and mortar to more consolidated view of things, and then incorporate virtual AI, all of these as a funneling pathway. Is what I'm saying is that if you were to get into the game again as an EHR physician, and then build a new sort of around the shop right here corner, like EHRs with hospital privilege, like the amazing thing you did and then got exit. But if you were to restart this game, how would you do it in this new environment that we're in?
I believe strongly it's about a win-win situation, right? Unfortunately, both sides of that equation are on opposite sides, in that the insurance wants to make more money for themselves and the hospital wants to have the money so they can give to the patients. It's how I see it. So to me, it's how do you make that perfect balance? And so for me personally, I see it as we would need to put more predictive analytics. There's a retooling, I call it the great shift. I love what Ed said about the percentage. 65% of people will get 85% of the care. Well, with AI, if that's the case, then you would think, why not lower the price of healthcare? But then there's that dichotomy, right? If I woke up one day and I said, hey, Janae, I'm only going to pay you 10% of what I used to pay moving forward, you'd be like, what? So there's that disconnect.
Let's say you're the king of the world, and then now you're going to create a new policy for VBC for US, where the economic realities are changed, including AI and everything. How would you reconstruct value-based care in the age of AI?
Well, insurance companies are a little bit more consolidated. So there's still a lot of health plans out there. I'm not an advocate of a universal payer system, but certainly if you wanted to do value-based care at scale, it would be nice to have it'd make it easier if there was a single system. So going back to answering your question, let's assume you're in a situation where you do have a single payer that covers the entire geography. So obviously you would deploy these same AI agents that we've been talking about, that I've referenced. So you have all these disruptors. So you would have to become the disruptor. Um, so that's how I would answer the question. What would you do in a VBC scenario? You would become the disruptor. You would offer multi-channel, omni-channel type of healthcare, including these agents. And if you did this, and if you really incentivize your patients to move this direction, I mentioned 65% of patients. If you could even move that to 80% of patients through incentives, through efficiencies, there might be some natural incentives that come if you're just more efficient. But if you had these AI agents that, again, people are using now and are going to use a lot more, you would then be able to move your access issue would be gone. Your PCPs that still needed would be very well employed, and the other ones would start doing specialty care. So, answer the question is, AI agents taking a lot of the primary care. That's the first thing right there. You'd become so much more efficient. Access issues would be gone. Quality would go up. Experience would go up. Costs would go down.
Love it. You're absolutely right. The pathways are going to be adjusted as well. Direct to specialty versus PCP to specialty versus concierge medicine. We're going to basically move to what we call tokenization economy, including, I think, US dollar going to convert to stable coin at one point and another in the next 2 to 3 years. So the question really becomes is that Harvey, how do you envision the tokenization of economy in general? And then more importantly, how do you think that will this tokenization be part and parcel of a VBC architecture, and who will own it? How would you centralize virtual VBC measurement through tokenization? Or I'm just hallucinating.
It goes back to what I kind of say always. It's the culture, right? That's radical. That's different. Will the culture accept it? Will the older generations of the people in power allow that to happen while they're alive? With that said, there's many ways that there's like hints of that coming, right? You look at insurance company rewarding you for better health, going to your annual visits, moving around more. Those metrics, the insurance company is saying, okay, you know what, we will pay you by decreasing your premiums. So that in a way is tokenization if you think about it. Who will own that pyramid? Interesting. Just because the way I see it is the powers are not going to want to let go of power, I would assume that it'll be the government pushing hard to have some hand in that, so that they own it. And then obviously the bigger insurance companies are going to make sure that they have their hand. What do you think, Ed?
Yeah, I agree. I think that's a great analysis.
My opinion is, and this is my slide, that the value-based care will be parcel and parcel of it. Now, how it will look like, I don't know, but this will be part and parcel, especially considering previously that 740 billion is going to be hopefully saved, and this will also create a real mechanism for a new form of reimbursement, that is, AI is always present monitoring the care. AI is tokenizing it. Agree with Edward Marks. Radiologist is going to become a real problem. As a matter of fact, their RAD partners and everyone are changing the reimbursement system from number of studies read to number of time spent, so that they decrease the overall cost of reading. That's true. That's going on now. And then lastly, I truly believe that we're going to see a tokenization of the healthcare economy in general. Basically, the idea would be that the back office, the front office, as it gets automated, the whole process is going to come forward more further, that you will be able to use quickly where to send, how to send, and AI can help coordinate care with you. Ed and Harvey, any last thoughts?
No, my favorite phrase, because I get this question a lot. It's like, hey man, how do I get better at AI? And I'm like, it's like riding a bike, right? The more you use it, the more you know it. At first, you freak out holding that bar really hard, and then later you're like, oh, dude, I could ride this bike without holding the bar. So, big picture, enjoy AI, do it in everything you do, because I do it for everything.
We were talking about AI. They were asking all sorts of questions. We were in a hospital setting, and they're into it. And so, man, it is a thing. It's real, and you either I used to always say innovate or die. We'll have to come up with something clever like that for AI, or maybe it's AI or die.
Perfect ending. We should put that in a banner. Age is no longer a barrier for a usage of AI. As a matter of fact, believe it or not, I've seen people who are at more extremes of ages more acquainted and malleable to use AI as compared to the middle road, which is a working class with their own biases that AI is going to take my job and everything, is more skeptical.